Can you imagine severe pain that runs down half of your brain, down your neck, into your shoulders, feeling pain through what feels like every single hair on your head, pain running through your jaws, pulsating into your teeth, unable to lift your head because it hurts so bad, unable to open your eyes due to severe of sensitivity to light, and unable to eat because of nausea. Now, imagine that pain for no less than 24 hours. Imagine no medicine in the world that able to take that pain away. About 29.5 million people who suffers from migraine according to the National Headache Society. Assalamualaikum and hello to everyone. My name is Nurul Darwiesha Binti Hashim from RSR 2433B. I hope all of us have a great and wonderful days. I interested to talk about this topic because I also have been suffering from migraine since I was in secondary school. So what I want to talk in this video is symptom and stage of migraine, causes and risk factors of migraine, and how to prevent migraine attack. So let's start with the first slide. Migraine can cause severe throbbing pain or a pulsing or tingling sensation, usually on one side but can be on both sides of the head, and are usually accompanied with a few symptoms. Migraine pathways start with migraine originate, which is deep within the brain, and then electrical impulse, which is it spread to other regions of the brain. After that, changes in nerve cell activity and blood flow. It may result in symptoms such as visual disturbance, numbness, or tingling and dizziness. And then chemical in brain can cause blood vessel dilation and inflammation of surrounding tissue, and lastly, inflammation spread across nerve supplied by the trigeminal nerve, which is nerve that near to our ear that causing pain. So we move to the next slide, which is stage and symptom of migraine. The first stage is prodrome. Prodrome is symptom may occur days before actual pain hits. Roughly half of all migraine sufferers experience this stage, which is characterized by symptoms of light and sound sensitivity, depression, irritability, and lack of appetite. Second stage is aura. Aura usually occurs up to 1 hour prior to the headache. 20% of migraine sufferers experience migraine's aura, a phase characterized by change in visual perception. Symptoms of aura include seeing flashing lights, geometric patterns that obscure vision, or even the temporary loss of half of the visual range. Next stage is headache, which is pain can be moderate to severe, lasting up to 3 days. Migraine pain may start on one or both sides of the head. Other symptoms may include intolerance of light and noise, nausea and vomiting, sensitivity to movement, and speech difficulties. And the last stage is postdromes. Postdrome symptoms can last several days after the headache and have been described as a migraine hangover. Most migraine sufferers may be irritable and fatigued. They may have difficulty concentrating, difficult to concentrate, and experience mood changes. The scalp may also be very, very tender. Okay, that is the symptom and stage of migraine. So as you can see in the slide, The source by Dr. Jokers said that migraine is not just another headache. In a national survey of American Migraine Study 2, said that a large percentage of people suffering from a migraine, which is 85% feeling of throbbing pain, 80% had a sensitivity of light, 76% sensitive to sound, and 73% feel nausea. This is the risk factor for migraines. The first one is family history. More than 90% of people with migraine has a family history of migraine attacks. So anyone who has a family member who is often attacked by migraines will be at risk for getting migraines. The second risk is the age. Migraine can begin at any age, but most of people experience their first migraine during young adulthood, which is during adolescence. Next factor is gender. Migraine affect 3 times as many women as men, which means women are more likely to have migraines than men. And the last risk factor is hormonal changes. Women who has migraine, they may feel headache just before or shortly after onset of menstruation. The migraine generally improve after menopause. As you can see in the slide, this is some of factors or causes that lead us to be attacked with migraine. So this is a few factors, which is added food seasoning, imbalanced nutritional deficiencies, hot weather, fast food, caffeine, stress, the smell of fragrance is too strong, irregular sleep, and others. And lastly, to prevent migraine attacks, we should practice a healthy lifestyle, take care of nutrition, and exercise regularly. That is the way how we want to prevent then migraine attacks. Thank you.